While they're coming up, I want to let you know that all of their bios are in your packets. And for time, because we want to allow you to have time to ask them questions, I'm not going to give their backgrounds, but you can read about them and why I'm so honored to be with them and proud of the work that they do. So to get us started, we're going to start with Louisiana Department of Health Interim Secretary Drew Maranto. Drew, you've just heard me review the state's health scorecard, and obviously we have a lot of work to do. Can you share what the department is doing with providers to move the needle, and what can these employers do to help with these efforts?
Well, good morning, everybody. Drew Maranto, great to be with you today. I only came because Michelle and Joan were here, so I'm just kidding. I've been coming to the Northshore for many years. I've worked for 3 of our U.S. senators. The Northshore has always stepped up, and I appreciate you for doing so. So I'm in my 3rd week as the interim secretary. I joined Governor Landry's administration when he took office, and we know we have a lot of work ahead of us. Michelle really gave you the thematic kind of view of where Louisiana is. All of these numbers that you see have pretty much stayed the same for the last decade or so. I just want to level set with you. You know, we're post-COVID. My department has a $21 billion budget. That's almost over 40% of the state's budget. We have 1.6 million people still on Medicaid. Half are children. 152,000 are dual eligibles, meaning they have Medicare and Medicaid. And you're dealing with a population that is unfortunately becoming sicker. We're seeing higher utilizations, increase in services needed. But coverage isn't necessarily access. You know, we see time and time again, we just cannot get, there's a lot of provider abrasion. Michelle and Joan, Tim and Tina, seen it all. You can't get specialists where you need them. You know, I feel like in this role, I have to own not just the health of our Medicaid population, but of everybody. I take that very seriously. Even if I'm not your, quote, coverage, or you're not in managed care or fee-for-service, you know, the ecosystem that Michelle kept alluding to, we have to think about that. We have to break down the silos. It's not just a kitschy statement. If I can't have good education for a family and economic opportunities for the spouse, how am I ever going to get a provider to practice somewhere? I have 24 parishes without obstetrics care. It's a scary fact to think about today. So I want to talk real briefly just about a couple of things that I'm thinking of and trying to grab the bull by the horns and move us forward. You know, Joan's going to talk about it. The partnerships here are key. I mean, they're huge. And we have to break down those 4 walls. So number one of the first things we did when we came in, we know that behavioral health has been such a dramatic issue for so many folks across the state. So that's an access barrier, number one. Even if your private pay can take you almost 6 months to see a clinician. I mean, you could go into crisis immediately. We just can't have that. So one thing that we've done, this administration actually, with the flip of a switch, was able to allow provisionally licensed behavioral health professionals that are in training to actually bill and see Medicaid patients. Never been done before. We immediately increased the amount of providers that folks could see. Some of you, if you're in the healthcare space, are probably familiar with 1115 waivers, and I'm sorry to throw all the jargon at you, but that's what the feds have left me with. So what we're working on, though, is we know that there's so many people in an incarcerated setting that simply should not be there. And we're working with CMS to get this waiver approved, so when an individual is transitioning out of jail or prison, that we can do some wraparound services with them before they get released. Get them with the primary care doc, stabilize them if they have a substance use issue, and get them the medications they need so that they can transition and get back into the community. You know, so those are just some quick things that we're focused on. Obviously, maternal mortality and substance use actually are very, very linked, and people don't quite realize that. The number one cause of postpartum death for a mom is substance use overdose. Second to that is crime or violence in the home. And then obviously you still have issues with post-eclamptic episodes and stroke. But we are trying to engage as many partners as we can to expand access, make our kind of ecosystem work for everyone. And so I'm sure I'll get an opportunity to comment on some other strategies and things we're doing, but just know that we hear you, we see you. I thank you for the work you're already doing. The economic impact of healthcare is tremendous in the state, usually the largest employer in many parishes. And so I just want you to know from me and for the governor that we're committed to working with you to move us all forward.
Thank you. So, Joan, St. Tammany is #1 in health outcomes. And as chair of the St. Tammany Corporation, you led an initiative to bring our parishes together to work collaboratively. Can you tell us a little bit about this work and why it's so vital to the business community and the North Shore?
Thank you, Michelle. Good morning, everyone. Joan Coffman, privileged to serve as president and CEO at St. Tammany Health System. Just by way of background, we celebrated 70 years of serving our community last year. And if you look at our mission statement actually begins with, "We are the heartbeat of our community." And I share that with you because I really am so grateful to have these panelists here today. Drew, you teed it up beautifully, as I fully expected you would. And Michelle, you really told the story of what's happening here on the North Shore. But when I think about St. Tammany Health System, and as you think about the successes and the challenges that we face, I think it's important to really hone in on the value of partnerships. We think of our health system when we go out into the community and partner with other stakeholders as an extension of our care. And I do think, as Drew pointed out, the value of that is so profound, and it's both in traditional and non-traditional partnerships. And so when I share that, let's talk traditional partnerships. You know, we have a partnership with Ochsner Health since 2014 that really has allowed us to extend not only a foundation of primary care, but specialty care so that we can keep patients here local. We don't want patients having to leave our community, and quite honestly, they don't want to. But as you heard this morning, the other value is that we have, in order to have a vibrant community, we really need a strong educational platform and strong healthcare services. Great outcomes for our patients in our community. So as you think about the partnership on the traditional sense with Ochsner Health, that allowed us to further expand cancer care with the relationship with MD Anderson, right there on I-12 as the corridor to Highway 21 and Ochsner Boulevard. So again, keep care local. We also were able to expand with a graduate medical education program focused on family medicine, so we can begin the pipeline for our physician providers in the primary care arena. But as Michelle pointed out, and Dr. Wainwright alluded to this morning, when you think about non-traditional partnerships, you immediately come to North Shore Healthscape. And Chris Massengale, I know, is in the room somewhere, but I give him tremendous credit, along with his team, for really taking the time throughout the pandemic to listen to the healthcare providers, to understand what our challenges were and where we really needed support and collaboration. You all have probably heard me use the term co-opetition. Yes, we may be viewed as competitors, but when you come together, you can achieve things far greater than you can alone. So I credit Chris for listening and then bringing all of the healthcare leaders from the major health systems in the tri-parish region together, along with our educational partners. Again, we can't do it alone. And together, we created the vision for a 3-year health sector pilot that's focused on, first of all, engaging someone to come in, Vision First. They are an advisor group that really took a whole look around the tri-parish region to better understand and educate, and then focused on workforce challenges and capacity, both immediate and short term, so we could stabilize the workforce. And then finally, to brand this together so that we could tell the communities that we serve what we were doing together and create an industry sector report that would guide our work. Many of the statistics that Michelle quoted are from that industry report. But it goes beyond that. And I would say education is the platform for all things. And so we also forged, as a health system, partnerships with Southeastern and Northshore Technical Community College, and quite honestly, Frank Jabia and the school systems to really look at how do we create a better pipeline. And they've been fantastic partners. We created the St. Tammany Academic Center to really have a hub in our community to do just that. Two other things that I think are important on the partnership front is Healthier Northshore. So while Northshore Healthscape is a tri-parish scope, Healthier Northshore is St. Tammany Parish and Washington Parish. And that is something that I think is truly powerful because so many constituents from legislative positions, healthcare, obviously, local organizations and not-for-profits came together last year with the United Way and LPHI to really look at our community health needs assessment together. And through that process, we identified 4 areas that we are going to focus on. The top 3 are chronic disease management that you heard Drew mention at the state level. They're focused on the same things, as well as maternal fetal health and also behavioral health. My point in sharing that is when you work together and focus on the same things, you can improve health outcomes. And then the last thing that I think is so important for our community is corporate health solutions, which has been around for almost 2 decades now, where we work and partner with our area businesses and industries to meet their needs and keep their workforce healthy and really focus on wellness and prevention, early detection, all of the things that if we catch them upstream, we can create better outcomes downstream. So with that, I'm going to pause and we'll move on to the next question. Drew and I know we can talk all day.
I was getting ready to cut you off, don't worry. Okay, so Dr. Tina Gundaldo, you heard earlier in the presentation that there's a lot of poverty and varying health outcomes in the region. And we know social drivers of health play a key role in this. Can you tell us what social drivers are and how you're attacking health equity, specifically in Tangipahoa Parish?
Okay, thank you for that question, and good morning, everyone. So, social drivers of health. Let's first start with some statistics, and they'll really mirror what Michelle said. So, 20% of your health is determined by medical care. 30% is determined by your health behaviors and genetics. But 50% of your health, as you sit here today, is determined by where you work, live, and play. And play could be an art class, or it could be an exercise activity. And this is what's called social drivers of health. So when we think about this, when we have opportunities to work and live in smoke-free environments, when we have opportunities to access healthy foods, whether that's at a convenience store, a grocery store, or even at our local restaurants, these are the opportunities to help support our health through socialization, through those social drivers of health. So before I start to talk about what we're doing at North Oaks in regards to health equity, I think it's important to tie the 2 terms. So why social drivers of health and why health equity? So if you think about, as an individual, you want to live in a very walkable community. Within that walkable community, there's crosswalks. Those crosswalks have been modified for us to include ramps so that someone who uses a wheelchair or someone who uses a walker, they'll be able to cross that street more safely as compared to being challenged by a curb. If that crosswalk has a pole that has audio or visual cues on it, that's going to help the individuals who are visually impaired or who have hearing impairments, right, to safely cross the street. So where we live is where we want to live, is in a very walkable community. We want to be able to safely cross the street. And these are the opportunities in regards to health equity. So the definition of health equity, which I probably should have mentioned before, are giving individuals the opportunity to achieve the health that they want to have. So if I give a ramp, if I give visual cues, if I give auditory cues, these are those opportunities to achieve optimal health. So 3 things that we're doing at North Oaks. One is that this fall, we're bringing together industry leaders because as everyone has said on this panel thus far, we can't do it alone in healthcare. So across education, business, nonprofits, you name it, we're bringing them together so we can identify the opportunities that currently exist in Tangipahoa Parish, as well as opportunities for us to seize as we move forward. The second thing North Oaks has done recently is we've created a central hub on our website for community resources specifically geared to these social areas. Food, transportation, how to pay for rent or utilities if that's your need. This is helpful because as an individual who might have that need or might be challenged, they're not going to have to go search that on the World Wide Web. It's right there for you. So I would tell you, if any of your businesses or organizations are in Tangipahoa Parish, utilize the North Oaks Health System website to connect your employees who are in need to these resources so they don't have to do that searching, but also it's a very personal situation when you do have those needs. The third thing that I'm very proud of, I know Michelle is proud of, I know my leader, I see her over there, Ramey Nelson is proud of, is that we've opened the first hospital-based food pantry in Louisiana that serves all of our patients across the system. So that's inpatient and outpatients, as well as our employees. And this is important in recovery if you have a medical condition, but it's also important to optimize the work for our employees, right? If our employees are worried about how they're gonna pay for their next meal, or they're worried about hunger, they may not come to work. They may not come to work optimized in terms of what we want them to do. So being able to provide that resource on site is valuable. So I'm gonna try to pull this together for you in a succinct way. You have an employee that makes $9.40 an hour working 40 hours a week. At this point, they're eligible for SNAP benefits or government benefits. As soon as they make $9.41, you remove the government benefits from there. When they make $13.40, so I should say this, between $9.41 and $13.40 an hour, they can then access their local food bank on a monthly basis to go grab a food box. But as soon as they make $13.41 and you give them a raise, you remove that safety net system for them. So they no longer at $13.41 for a household of one have access to government benefits or a monthly food bank. So what can you do as an employer or as a community leader to support them through this time? Because it will take up until about $15 an hour in order for them to achieve that food security that they had with SNAP benefits and the monthly food bank. One, connect them with the resources that are available in your community. Two, give them flexibility because all food banks and food pantries are not open 5 days a week, 40 hours a week. And three, create those bi-directional relationships with those community organizations. And I think I'll just wrap it up here because I'm being mindful of the time as well. But I think we all know is if we can help support our workforce and our team members to be healthier, whether that's physical health, mental health, social health, we know absolutely they're going to come to work stronger. They're going to be there as a support system for their family. And most importantly, they're going to create that community level health that we all want when we choose where we go to work, play, and live. Thank you.
Thank you. Dr. Riddell, what is the use case for AI in healthcare? And given that mental health disease is on the rise, how can employers support a healthy lifestyle to ensure their workers are present?
So there's a lot there, right? First, thank you to Southeastern and the College of Business. This is a remarkable opportunity to talk about an incredibly important topic. And as we think about AI, I think it's important to think about that in terms of the broader technology that exists in the world today. So as you look at the separation that we just described, the distance between 1st and 50th, even that distance between 25th and 50th, it's important to remember that the rest of the world is continuing to improve. They're continuing to identify new ways to deliver health, new ways to provide healthy outcomes and healthy outputs. And much of that is being done in the technology space. And so in many ways, the new technology that is coming, if we don't adopt it, we're going to continue to see us fall behind. And that new technology is going to help us advance the care of patients, but it's also going to help us serve some of these workforce challenges. I was asked the other day if AI was going to take my job, and I said, look around, we don't have enough individuals to fill those jobs. So what we need to be thinking is, how is AI going to allow me to do my job? And if you look at the space in AI, we are at an inflection point in the healthcare world around AI. Many of you may know this, may not. It is already being used in a significant sense across your care. One really good example of that is in the hospital. So at our hospitals, we currently are tracking all of the data, all of the vital signs, all of the labs, and using that as an early indicator that someone may be having a significant decline in their condition. So that allows us to more early interventions that allow us to prevent people from having sudden decreases or declines in their health. But then you can start looking at where we're using that directly taking care of individuals. Some of you might go to a doctor's appointment now and the doctor pulls out their telephone and there's actually an AI robot that listens to that visit and writes down a note based on what was said. And it's not a transcription. I've dictated in my phone, my notes in my phone. This literally listens to what I say, what the patient says, and writes out a note the same way I would write out a note about what we talked about. And as you move into the future with this, the future represents a number of incredible opportunities, some of which we have to be aware of and we have to be understanding of, and some of which are going to radically change how we deliver care. I'll talk about one really large one that we're seeing in the mental health space, and that is the ability to have someone who assists in counseling by having an avatar or a AI that communicates with someone in a time where they're having stress or anxiety, and doesn't diagnose them, doesn't tell them that they have depression or anxiety, but helps give them tools and techniques to continue to deal with the challenges that they face. Interestingly, over half of individuals under the age of 30 want to actually interact with a non-human interaction because of embarrassment, because of concern about the privacy of what they're talking about, and wanting to interact with different ways and different approaches for this. And then lastly is the ability to expand care. The ability to put a psychiatrist in every parish in Louisiana is probably not something that's going to be viable or doable. But the ability to put a connection to a psychiatrist in every parish in Louisiana is a doable process. You wouldn't think that broadband capabilities would be a key driver of health, but in what I just described, if you don't have access to good Wi-Fi or good broadband, there's no chance for you to be able to do this. Lastly, is every single one of you is sending in hundreds, maybe even thousands of pieces of data right now as you sit here. It's on your watch, it's on your phone. I've got some on the ring that I wear, and that information has to be processed and understood. But it can be processed and understood to a degree where you can get immediate feedback about your health. A good example is I was hiking, thinking I was being healthy for a change, and I fell down. And my watch immediately said, "You appear to have fallen, are you okay?" And I said, "Yes, I'm fine." And as I was walking, I guess I was a little wobbly because it can tell that. And it said, "Are you sure you're okay? We can call an ambulance for you." Now, I was out hiking. Imagine if that was my grandmother and she fell in her home, and this allowed her to get quick access to care and immediately send someone to her house to help her with that fall. So there are so many opportunities. The world of healthcare does not look like the Norman Rockwell portrait that you that you have seen in the doctor's office, but instead is going to look like this giant care team of individuals and of technological support that's going to help us in the future.
Thank you. So we have time for one question. Tanya, do we have a question?
The first question that was submitted says, how will tariffs affect healthcare industry and healthcare outcomes in Southeast Louisiana since the cost of materials and pharmaceuticals can be affected?
I can take that. I think there are a number of challenges across this piece. So first, let's talk about the price of pharmaceuticals. That is already a challenge. So there is a real concern about the continued challenges of the overall price of pharmaceuticals. If we look, the number one costing drug right now actually is the GLP drugs, Ozempic and those types of drugs. But as you think about that, those drugs also are designed to fight the number one health problem that we face in our country, and that's obesity. And so those are going to be continued challenges that we face. All of us in healthcare have responded to the pandemic, at which times we had tremendous challenges around protective equipment and protective gear. We have all responded to that by creating multiple pathways to receive that equipment and receive that gear. And then lastly is something that we recently faced that only recently got solved, that was a very interesting challenge that, we're used to being affected by hurricanes here in Louisiana. But we were recently affected by a hurricane in North Carolina. The largest producer of IV fluids in the United States, 60% of the IV fluids that are used in the United States was being produced at a factory in North Carolina. And so many hospitals had to change or adjust surgical schedules to account for those missing IV fluids. So there is a tremendous amount of complexity in all of these supply chain challenges that we have to continue to work on solving on a daily basis.
Thank you. Okay, another question?
Yes, we have someone who is responding to the conversation you had about the lack of employees and the need to have employees continue to work longer, and the fact that working and getting up and moving helps our aging employee base stay healthy, but Social Security policy punishes people for working beyond retirement age due to increased Medicare premiums. So if anyone on the panel wants to talk about that issue.
I think I'm going to go at the 50,000 foot level, and this really ties into the previous question about tariffs and impact on supply chain as well as workforce in general. And what I'm sharing with you is going to be the blind glimpse of the obvious, but I think it's so important that we have a voice in what's happening. And I think being that trusted advisor as a healthcare leader or somebody in the industry with our state leaders as well as officials, as well as the national level, because as we are experiencing things, we need to let folks know and see where the common themes are occurring so that we can get upstream and not stay downstream. So I advise you all to join us in being that trusted advisor. We have a number of legislators here in this room today, making sure that you are meeting on a regular basis with those individuals to let them know what's happening, what's impacting your industry and organization, and how you have partnered. And I think it's a great example. Dr. Riddell mentioned the hurricane in North Carolina. When that happened, our health system didn't use the same vendor that Ochsner did and others. So we still had a pipeline of supplies, but through the coalition, we're able to keep in touch with one another to say, hey, how are you doing? What do you need? We shared supplies with Ochsner. We also shared supplies with Riverside Medical Center in Franklinton, Louisiana. Now that's not long-term and sustainable, but I think it also lends itself to the power of those partnerships.
Thank you. Last question.
Building off that question, how are our local healthcare providers adjusting to the lifestyle medicine approach we see at the federal level?
I'll just share a quick comment. You know, I love a microphone. I mentioned our graduate medical education program that we have put together. Ochsner is the sponsoring institution. One of the things our program director did immediately when she was putting the curriculum together for family medicine was to avail the landscape and see what we needed to focus on and build in a lifestyle medicine curriculum into their curriculum for family medicine, so that every one of those residents who graduates, and we'll have 24 at the end of a 3-year cycle, have the ability to practice lifestyle medicine. And again, that's really a big name for looking ahead, being proactive in care, wellness, prevention. You may have heard, you know, the blue zones that are out there across the United States and throughout the nation. I think it's so important that we really get back to basics and focus on true lifestyle medicine so we can improve the health outcomes of everyone.
Yeah, and Michelle, I want to add on to that. I think, you know, that's not, though, as simple as better food and more parks. As we talked about some of the social determinants of health, there are people who have real opportunities to understand the impact of their health choices in a better way. A good example is I worked with a dietitian recently who goes to local grocery stores and works with people who have SNAP benefits to shop with them and understand how to make those choices, and then go to cooking classes to learn how to cook the food in a way that they will continue to make those kinds of choices. And that is not something that people just know intuitively, but have to continue to be taught and educated on.
And I would just like to add to that, coming from an academic health sciences center for almost 2 decades and then entering back into the healthcare delivery space. So there is a gap between what we provide education on so that we can graduate individuals who can practice safely right in the public's eye. And so just like Joan has said, we need to go a little bit further upstream. I can't say to what every provider is doing these days in terms of lifestyle medicine, primary prevention, family medicine, primary care. But what I do know, it's going to take more than just a physician associate, a nurse practitioner do this work. We really have to embed lifestyle medicine into all of our entire healthcare team members' academic curriculum so that they are prepared to talk about primary care and prevention once they enter into the healthcare delivery space.
Thank you. So I think you can see by their answers, their engagement, why when I showed you that vision, we had the smiling emoji, because of the extraordinary work that these leaders are doing in their community. Please reach out to any of us. We want to be a resource. We want to be your partner, because this is our community and we wanted to make it as healthy as possible. So please join with me in recognizing our esteemed panel one more time.